I'm back. Did Dr. Matthews come talk to you all about palliative care?
Yes, she had stopped by earlier and said that she had ordered a palliative care consult, and but we're not really quite sure what that is. So if you could explain that to us a little bit more in detail, we'd appreciate it.
Yeah, of course. I'm just going to go ahead and close the door to provide a little bit quieter space here to do so. Do you have anyone else who would like to be part of this conversation and explain about palliative care a little more?
No, it's just my father and myself.
Okay, great. Well, palliative care is a special team here at the hospital who works with patients who have serious illnesses, such as COPD, like your dad. And their goal is to help families and patients in decision making. They will meet with your dad's doctors and they'll get to learn his conditions and be able to meet with you and explain that condition as well as treatment options in an easy way to understand. They'll also meet individually with yourself, with your dad, to understand what's important for him, what at this stage in his life, and what his goals are for future care. Is that something that you guys would be interested in, or does that make sense?
Yeah, we definitely want to learn some more about that.
Okay, great. To help to little understanding in terms of how you understand your dad, could you explain to me what you understand about his current condition?
Yeah, lately he's been actually deteriorating as far as his everyday living. His breathing's been getting a little bit more difficult. His dementia's getting worse. His daily activity as far as getting dressed, it's not as easy as it used to be, and I just don't know what to do at this point.
Yeah, I understand it. It's definitely very frustrating and very scary. I mean, as I mentioned earlier, I saw him a few weeks ago when he was here, and I can definitely tell in his breathing that his health has deteriorated in that short amount of time. So, I understand it's very scary, and I am very sorry about that.
I am. I'm getting, a little scared and just don't know what to do at this point.
Yeah. Oh, would it be okay if I share my opinion with you as far as being his nurse?
Yes, please. We'd appreciate that.
Yeah. Well, I would, as Dr. Matthews mentioned, I would happen to agree that this would be a good time to reflect on what his goals are for his medical care, and also to think about what he would want if he were not to recover as he has before, and if he would not be able to return home.
Is that hospice?
So palliative care often gets confused with hospice, and although there are some similarities, there are some differences. Hospice focuses on patients who are at end of life. At those patients have chosen not to continue with curative treatment and are more looking to spend the end of their days in a comfortable place such as home and not in a hospital. Palliative care works with patients on all ends of the spectrum of a chronic disease, whether it be, or a serious illness, whether it be at the beginning of diagnosis or whether this person's been handling the disease for many years. So they can work with patients who are in hospice, but again, they can work with anyone else at any point of a serious illness. So their goals, again, is to just get a better understanding of what the patient would or would not want in terms of focusing on treatment and goals now and treatment goals in the future.
Okay, that makes sense. So that would be something that we would like to actually check into and see if that was something that would help us.
Perfect, great. So I believe they'll be in later on today, or maybe early tomorrow if they don't get a chance today. But I will be here for the rest of the shift till about 7. So if you think of any other questions, go ahead and let me know.
Okay, perfect.
Okay.
Thank you
Very welcome.